Yesterday, the Japanese tennis star Naomi Osaka withdrew from the French Open, citing mental health concerns. As a woman, person of color, and elite athlete, she said she experiences huge waves of anxiety before meeting with the media and revealed she has long suffered bouts of depression. After being fined $15,000 for refusing to speak to the media on Sunday, the Associated Press mentioned today that the leaders of the 4 Grand Slam tournaments reacted by promising to address players' concerns around mental health. Now celebrities all around the world are showing their support for Naomi Osaka as she prepares for the 2021 Tokyo Olympics in her home country. Hi, my name is Dr. Justin Adam Gelsizer, and this channel is all about mental health and science. Please support this channel by subscribing below and hitting the like button. You won't want to miss this scientific perspective on mental health, elite athletes, and the positive impact that they can have on the general public with overcoming stigmas surrounding mental health. Let's take a quick look at 4 different research studies that can help us understand the pressures that elite athletes face and the positive impact they can have on others. First, the media can play a major role in either supporting or worsening the mental health of elite athletes. A 2009 study looked at 2 professional basketball players, DeMar DeRozan and Kevin Love. It talked about the negative but also the positive impact that journalists can have when they permit athletes to directly share their message concerning mental health with the readers, including, in the positive case, the positive reception of teammates, coaches, and the public, and the need for an end to mental health-oriented stigma. Furthermore, the positive news framing of athletes' disclosures shape fan attitudes toward mental health, mental illness, and people who experience mental illness. In line with the statement, the Associated Press followed up with some really positive news about Naomi Osaka. Those in charge of the French Open, Wimbledon, US Open, and Australian Open said that mental health is a very challenging issue, which deserves our utmost attention. It is both complex and personal, and as it affects one individual, does not necessarily affect another. We commend Naomi for sharing in her own words the pressures and anxieties she is feeling and empathize with the unique pressures that tennis players may face. This was a much better response to Naomi Osaka versus the $15,000 fine that they gave her on Sunday for refusing to speak to the press, as it enters into the international spotlight with the upcoming Tokyo Summer Olympics. This string of events can hopefully lead to major improvements in supporting athletes as well as having a positive influence on a massive international audience. This is particularly important as a 2016 study talks about 60 different articles that they examined in regards to mental health and athletes. It found that the mental health and well-being of the elite athletes population is vulnerable to a range of mental health problems, including substance misuse, which may be related to both sporting factors such as injury, overtraining, and burnout, and non-sporting factors. As major organizations like the NBA, tennis Grand Slams, and even the Olympics profit off of elite athletes, it is important for them to do everything they can to support the mental health of those who participate in their sports. In fact, a 2019 study acknowledges that an athlete's mental health needs are as important as their physical health needs, and that both are likely to contribute to optimizing the athlete's overall well-being in conjunction with performance excellence. It also proposes a new model for mental health interventions for elite athletes. One, helping athletes develop a range of self-management skills that they can utilize to manage psychological distress. It looks like Naomi's courageous move showed strong self-awareness and willingness to protect herself as she became overwhelmed. It appears a range of self-management skills helped her recognize a problem before it became worse and deal with the issue head on. 2, equipping key stakeholders in the elite sporting environment, such as coaches, sports medicine, and high-performance support staff, to better recognize and respond to concerns regarding an athlete's mental health. Building a positive and well-trained support network is key in the mental health of elite athletes, and it can aid in the prevention of both unintentional and intentional traumatic injury and death. 3, It highlights the need for specialist, multidisciplinary teams or skilled mental health professionals to manage athletes with severe or complex mental disorders. For those athletes who are most at risk, more professionals need to be made accessible to them so that a greater collaborative community can provide support in all aspects of their life. A 2018 article entitled "Young Black Men's Information Seeking Following Celebrity Depression Disclosure, Implications for Mental Health Communication" is a study that surveyed 182 black males aged 18 to 34. So this study sought to understand factors associated with young black men's information seeking. The findings suggest that celebrity health disclosures are associated with proactive health behaviors among the sample. If Naomi Osaka's situation is handled with the utmost care and respect, this can have major implications for providing all athletes, from elite to college and high school, substantive mental health support, as well as have positive ramifications for members of the greater public. The enormous pressure for Naomi Osaka to win a gold medal for her country in this Summer Olympics in Tokyo is also a chance for places like Japan, that has one of the highest suicide rates per capita in the entire world, to break the stigmatization of mental health in their countries. After living in Japan for 4 years, I understand the senpai-kohai system, or the hierarchical system that puts pressure on people to succeed and not speak out when they're going through a hard time. I even remember visiting Mount Fuji, and at the base of the mountain there's a forest that is actually infamous for suicides. This is also an amazing opportunity for the host countries who host Grand Slam tournaments such as the US, France, England, and Australia to use the strength of Naomi Osaka and willingness to be open about her mental health challenges, not just to reduce the stigmatization of mental health around the world, but also offer greater resources to those who are at a higher risk of being impacted by them. Please comment below with your thoughts about this video. Have you or anyone you know ever had challenges with mental health? What resources were most useful for you and what impact did they have on your life? What do you guys think about Naomi Osaka's situation? Thank you for listening. If you haven't yet, hit the subscribe button, hit the like button. Thank you for listening. See you again soon.